Good morning and welcome to this webinar on Capture the Fracture Partnership Policy Tools for External Engagement. My name is Anastasia Soulier. I am the CNS and Capture the Fracture Partnership Initiative project leader at IOF, and I will be the moderator for today's session. It is a real pleasure for Professor Cooper today to launch the Capture the Fracture Partnership Guidance for Policy Shaping document, which was developed within the framework of the Capture the Fracture Partnership project. Before we start our session, I would like to inform you that all participants are automatically muted for the entire duration of the webinar. I would also like to encourage you to ask questions during the session by typing them into the question box of the control panel. I will voice them to Professor Cooper during the Q&A session we have planned at the end. This being said, I will now leave the floor to Professor Cooper.
Good morning, good afternoon, good evening. It's a pleasure to talk to all of you regarding this Capture the Fracture Partnership webinar on policy tools for external engagement. For those of you that I haven't met, I'm Cyrus Cooper. I'm president of the IOF, and I'm delighted to be part of this multi-stakeholder venture. So you're well aware that Capture the Fracture was an IOF initiative that we commenced in 2009-10 with a literature review of post-fracture care systems worldwide at that time. That proceeded to a description of the ideal fracture liaison service, as well as the key performance indicators and mapping of those services over the subsequent 10 years. In this particular initiative that we're delighted to be undertaking at IOF, together with the University of Oxford and our corporate partners Amgen and UCB, we extend that Capture the Fracture initiative to the partnership, and that has 5 different components. Today's main focus is the first of those, policy change, which is to drive fracture prevention policy change and prioritization with governments and payers. The other 4 components include advocacy through establishment of coalitions between global, regional, and local secondary fracture prevention and post-fracture care societies, governments, and NGOs. Mentorship to provide best practice support in different parts of the world. Scalable solutions, which aim to improve scalable PFC solutions and provide a global resource for this. And then lastly, a digital tool, which leverages digital global data sets to obtain consistent understanding across different post-fracture care sites. And as you see in the left-hand panel, our overarching objectives are to increase the number of patients served by PFC programs worldwide, to improve by 25% the number of such programs by the end of 2022, and to add 320 new PFC programs by early 22, with 67 new and 105 existing sites added to the map. And these new programs will have served a further 15,000 patients. The regions of the world that are covered by the initiative include Asia Pacific, Latin America, the Middle East, and Europe. And the principal countries in our first wave are shown here also, ranging from Argentina through to Turkey. The aim of the policy pillar is to drive policy change to prioritize these post-fracture care programs nationally and regionally. The outcome measures will include national policy changes to prioritize programs, national and regional funding and coverage, an increase in the quality of existing programs, an increase in the number of new PFC programs, and an increase in engagement with policymakers. The principal reason for this particular webinar is that we have launched the generic narrative document, the Guidance for Policy Shaping for Capture the Fracture Partnership. This consists of a major document that will be a resource for countries worldwide that carries an executive 1-page summary, a country-specific policy landscape assessment, and a benefit calculator as adjunct to the policy generic narrative document. There are 4 components which I will go through in greater detail as we move through the webinar to the action: catching fractures early, treating fractures well, preventing across the life course, and enhancing engagement. The policy pillar objectives are to identify key stakeholders and strategies to effectively drive these policy changes, to support osteoporosis as a national priority in the countries at hand, and to advocate for post-fracture care coordination programs and fracture liaison services, this undertaken with one of our major stakeholder partners, the Fragility Fracture Network, particularly in countries where FFN has established such local networks. The generic document will be supplemented with, as I indicated, a country-specific profile, which uses the alliances in each country to build a response on the current and future burden of fracture, the recommendations and implementation plan, the existing and planned policy priorities, and the expected benefit and their budget impact in that country. So now let's turn to the narrative document, Guidance for Policy Shaping. This comprises, in its first part, a call to action that's national, regional, and local, a section on making the case, and then lastly, the building blocks of an effective policy response, which I elucidated in my initial overview slide. First of all, the call to action. So it defines a post-fracture care coordination program. A fracture liaison service is one such example of such a program. These are coordinated systems of care which identify, treat, and monitor patients presenting with a fragility fracture. These programs are the single most important health service intervention to reduce the risk of subsequent fractures. As part of our call to action, we map out the estimate that by 2025 there will be 13.5 million fragility fractures worldwide, with a huge attendant economic burden, and 500 individuals with osteoporosis. Urgent action on osteoporosis and fracture prevention is required, uniting patients, carers, and clinical leadership with wider societal and political advocacy actors to strengthen the call for change. The second part of the call to action is to recognize that 80% of fracture patients are never offered screening and or treatment for osteoporosis, and these have been ignored in health policy for far too long, despite their huge burden and the availability of effective treatments. The third component in the call to action is the knowledge that osteoporosis and fracture prevention lie at a sweet spot in terms of the cross-cutting reasons for long-term care institutionalization and the expected reduction from making healthcare interventions, so that we can achieve a really pretty substantial reduction in frequency of disease burden and impact long-term care institutionalization, importantly, in this disorder, as compared with, for example, dementia, for which we have a huge burden of institutionalization, but little in the way of effective incidence reduction. And on the other hand, coronary artery disease and lung disease, where we have substantial impacts on healthcare, on the reduction in the incidence of disease, but these are not important determinants of long-term institutionalization. So that's an important part of recognizing that osteoporosis and fracture prevention are components that offer policymakers a really fruitful avenue for their work. At the national level, we acknowledge the importance of subsequent fracture prevention. We actively support efforts to improve public awareness and aim to develop a national consensus. At regional and local levels, we undertake comprehensive falls assessments. We have person-centered multidisciplinary models of care included within our anthology, and we support the role of primary care physicians. In terms of making the case, we use the WHO definition of osteoporosis and the known types of fragility fractures to characterize the diagnostic category and burden. We make the case for the cost of inaction. Economically, stroke costs 20 billion euros, fragility fractures 37.4 billion euros, and coronary heart disease 19 billion euros each year to the European Union. And now let's turn to the effectiveness of our policy response: catching fractures early, treating them well, a life course preventive approach, and the enhancements of engagement of patients and the public to understand the problem and shape our policies. In Catch It Early, we promulgate the evidence that all clinicians and policymakers should be made aware of. The first fracture gives rise to subsequent fractures, and indeed the imminent risk of fracture, the early rise in fracture risk, is substantial. A previous fracture, particularly a recent one, is one of the largest risk factors we know of after age and sex for future fracture risk. Taking time before intervening leads to avoidable fractures occurring. So time here is not money, but avoidable fractures, which then in turn become economic cost. Third, post-fracture care coordination programs are effective at identifying individuals with index fragility fractures, and they pay for themselves as well as yielding health and economic dividends. The second component of catching it early maps out the current situation. Fragility fractures are often misdiagnosed and improperly treated from the point of view of preventing subsequent fractures. Clear national guidance needs to be developed. PFC coordination programs need to receive priority funding, and automated methods of fracture identification need to be researched further. And on the right-hand side, you can see that countries with a clear national guideline on identification and treatment in terms of post-fracture care have a much greater proportion of identification and treatment with rates of osteoporosis and falls as the outcome. Treating it well involves facilitating post-fracture care. First of all, the knowledge base. Health systems regularly fail to close the osteoporosis treatment gap. Excellent care and rehabilitation requires a multidisciplinary team. There's an effective framework for such multidisciplinary coordinated care to reduce long-term fracture risk, and these best practice models are needed globally to increase access to high-quality post-discharge care. PFC coordination programs have been shown to be cost-effective and sometimes cost-saving, and the benefit calculator that is linked to our policy work, undertaken with colleagues at the University of Oxford, Professors Kasim Javaid and Dr. Rafa Pinedo Villanueva, and my own colleague here, Dr. Nicholas Fuggle, will characterize in each country the number of individuals who qualify for post-fracture care each year, the number of subsequent fractures that would be identified and prevented by intervention, and the cost utility of this overall approach. And lastly, in Treat It Well, what needs to be done? The IOF Capture the Fracture programme will promote PFC coordination programs that characterize effective local care pathways, as well as assisting in their planning and implementation. We'll provide real-time quality improvements, embedded quality assurance, and embedded health economic impact. We'll provide ongoing clinical support and mentorship, and professional and patient resources. This integrated package is intended to be a state-of-the-art for countries which wish to intervene in post-fracture care policy. And the tools will supplement those that are already available within our IOF Capture the Fracture initiative, the Global Patient Charter, our educational webinars, our toolkit, slide kits, and the best practice framework. Now let's turn to prevention throughout the life course, so-called healthy active aging. So preventing falls and fractures in later life entails good health throughout the life course, and falls seem to mark a watershed moment in rapid deterioration of health and function. So we will integrate falls prevention in promotion of bone health within our policy frameworks. We'll provide adaptations of the living environment and ongoing support to promote function and independent living. We'll integrate these prevention and strategic approaches to falls within bone health services locally, and we'll recognize that 80% of our fractures occur over age 70 and 90% result from a fall. And lastly, policymakers will be informed on enabling adequate funding and comprehensive falls risk assessment in health and social care services, just as has been undertaken recently in the World Health Organization's decade for prevention of dysfunction and reductions in intrinsic capacity associated with ill health among older people. And lastly, but by no means least, enhancing public and patient engagement, awareness, activation, and self-management. We'll increase public awareness, increase active engagement, and tailor treatment plans to patient needs in all cases. So that is a quick summary of the Capture the Fracture partnership in its 5 component programs, and a more detailed summary of the policy pillar and its generic information anthology. We look forward to engaging you in this unique partnership between Amgen UCB, the University of Oxford, and the International Osteoporosis Foundation, and we welcome you aboard this train, which will end at stations which serve to reduce the incidence of subsequent fractures worldwide. Thank you very much for your time. I look forward to your engagement and welcome your questions. Thank you.
Professor Cooper, thank you for this excellent presentation. I will now open the Q&A session, and the first question that we have is the following. Do you tell us about the cost effectiveness of FLS in our own country?
Absolutely. The benefit calculator utilizes country-specific data which are obtained from both a systematic review of the literature, from anthologies built up by key opinion leaders in the country-specific alliances, and they're then used in a novel high specification calculator developed at Oxford University, which characterizes the costs of both the disorder, its attendant fractures, the costs of the intervention, and the cost effectiveness or cost utility in terms of quality associated life years saved that's obtained by introduction of the post-fracture care regimen. And we look forward to this joining a series of such rather less detailed benefit calculation models that have already become available over the last 3 or 4 years as part of the Capture the Fracture initiative itself.
Thank you very much, Professor Cooper. The second question is the following. My country was not listed in the slide showing the list of countries that are part of this initiative. So what are the opportunities for my country?
Yes, that's a very good question. And of course, it's impossible to deal at this scale and with this intensity of approach in terms of the coalitions, the mentorship, the scalable solutions, and the database with all of the countries of the world together. Clearly, we represent a vast majority of the people worldwide in the IOF, and our ultimate goal is that these tools will become available to all of the countries that are represented in our Committee of National Societies, ably led by Jean-Yves Regenster, our Committee of Scientific Advisors, led by Nick Harvey and Serge Ferrari, and of course, our Corporate Advisory Board. We hope that this would be extendable worldwide. To start off with, we've selected these countries as representative of the geography regionally of the continents. We'll initiate work in each of these countries, and we'll make the generic documentation available to all countries. And thereafter, as countries approach us that are not within these initial waves, we'll try and adapt the models to meet their purposes best. And at IOF, we're committed to promulgation of this story worldwide, albeit in this graduated manner.
Thank you, Professor Cooper. The last question that I have is the following. What is happening to the CTF program?
Well, I personally am passionately interested in CTF itself because I recall not just the initiation of a fracture working group all those years ago, but also the delineation of the title Capture the Fracture and the first one or two publications which provided really the description of what was going on worldwide at that relatively early stage, initiated, in my experience, in Glasgow, but also popping up on the west coast of the United States, in Canada, in Australia, and then developed that through the CTF initiative that we've come to recognize. There is no way that we will discontinue that CTF initiative. What I'm hopeful of, and it links to that initial question about other countries, is that the CTF initiative actually enables the promulgation of these 5 components of the partnership to the whole of the Capture the Fracture organization.
Thank you very much, Professor Cooper. We've now come to the end of the questions that we received from the participants. So would you like to say a few words to close the webinar before I conclude?
No, I just think that I would like to say a great vote of thanks to Philippe Albou, yourself, Anastasia, Dominique, and all of the Capture the Fracture Partnership team at IOF, to my own colleagues here in Southampton and at Oxford. Nicholas Fuggle had a major role to play, and of course Kasim Javed and Rafa Pineda Villanueva in Oxford have been the principal foci at the University of Oxford for this collaboration. To Bess Dawson-Hughes, René Ritzeli, and all of my colleagues on the EXCO who have committed themselves to the success of this project, and of course to the enormous and highly effective corporate partnership team from Amgen and UCB, without whom it would have simply been impossible to undertake a task of this magnitude. We're all working together really well in remarkably difficult, I would almost say unprecedented circumstances. Yesterday morning, I was actually giving COVID vaccines in my hospital. So it is an unusual set of circumstances, but we're making fantastic progress. And I really urge all of those of you around the world who are interested in it to come on board with us. Thank you very much.
Thank you very much, Professor Cooper. Now, on behalf of IOF, I would like to thank you for your participation to this webinar, and I hope that you enjoyed this session. We'll publish the recording of this webinar on the IOF website, and you'll also receive the link by email by tomorrow. In the email, you will be prompted to complete a brief survey, and we would appreciate your input and comments as we continuously try to deliver webinars that meet your needs. And if you have any questions or comments, please don't hesitate to contact us. I would like to thank Professor Cooper once again for his outstanding presentation, and I would like to thank you all once more for your participation. I wish you all a very pleasant day ahead. Goodbye for now.
Great.